was 1997. That's when I decided to come back to Korea because of my wife. Yeah, I was a well-established dentist in the States. I opened up from cold in 1990. Then after 7 years, my wife said, "Wonhee, how about if you go back to the Korea?" What? But the reason I came back was because of my wife. There are a lot of differences. Major difference is the fee schedule is different. And then most of the US patients are covered by the private insurance. And then in Korea, there's most of the patients covered with the national health insurance. And then it's all private pay. So I guess the payment schedule is different. It all depends on the patient, of course. Yes, some patients are very dominant about as their treatment plans. Some patients, there's doc, you're the doc, you know what to do. Just I leave everything up to you. U.S. patients, because physically they are a little bit taller patients, and so their mouth is a little bit spacious.
Because I've heard a lot of patients told me that you have a golden hands. Because they're like when you give them a freezing.
Right. Anesthetics. When I give them anesthetics,
they don't feel it. I don't believe that actually.
Right.
But I don't know. What are you doing when you give them an injection? Like, are you hypnotize them?
First of all, I hypnotize them with my voice. And then I go, there's what we call gauge theory of pain perception. So I've heard one of the patient when I was giving most tough area to get the anesthetics is the upper front teeth, this part of the region. So I gave that rather young lady, she was about in mid-40s, and I gave the anesthetics, and she was, after the anesthetic, this is art. Yeah, so I shake a little bit, and then I talk to the patient, so how was your day? So then I give anesthetics. So I think that distraction for her to concentrate on getting the anesthetics, I think what makes that for her to be painless, getting the anesthetics, yes.
Well, as a person who works here, I know that you're not doing any excessive fees.
I try not to.
Yeah.
Realize we have high rent overhead.
Well, sometimes we are worried that you might not be able to pay us salary.
Exactly. We have many beautiful and very devoted staff. They are so devoted in patient care. I appreciate their, the efforts. So of course, as a head of the office, I have to, meet their needs, right? Of course. But yeah, I think there are enough dentistry to go around, even without doing extremely harmful, I shouldn't say, or aggressive treatment. I think there should be a room for that. I still believe in that, hopefully.